it's very rare for a patient who has disc disease to the extent that is actually touching the spinal cord to get better without surgery.
Okay.
What I'm doing with my technique is not reproducible by any other physical therapy method to my knowledge.
Right.
And so you're telling me that with the use of my technique, basically, and my manipulation, you have had a dramatic reduction in your arm symptoms, which you were getting due to the disc touching the spinal cord.
Yeah.
And
obviously,
so it's very uncommon for people to be able to say that they can do that. And so I'm getting a proof, basically, that it's not just me saying that I'm able to do it. You are a proof that it can be done. Because you're about the fourth patient now in the recent past that has had actual compression of the cord seen on MRI that once my technique is employed, resolves. And so you're saying that you're using my technique, you understand it, you understand the mechanics of it, and you're able to get yourself out of pain when you're in pain. And ever since you had your discs put back in and re-centralized, you haven't had the weakness and your, what did you say, you're not dropping things?
I'm not dropping things. I can
You
pick things.
you used to have an inability to hold things with your hands because
Correct.
you didn't know where your fingers were.
Correct.
Because the numbness and the loss of sensation and the weakness made you clumsy and unable to manage manipulating things with your hand.
I don't know what it was. All I know is everything in my hand ended up on the floor.
Yeah. And you had
multiple times.
Unremittent neck pain.
Yes.
And shoulder pain.
Yes.
What's that? Now that, the upper neck and shoulder, the shoulder closest to your neck part, the part of the shoulder close to your neck, that pain is largely resolved. You aren't needing narcotics anymore.
Correct.
So that was one manipulation with my specific technique, not a chiropractic manipulation, but a technique of mind manipulation, which is a maneuver basically.
Right.
And I taught you that maneuver, and you evidently did use it successfully to get out of an episode of pain, right?
Yes.
Okay. So, and the understandings that I gave you about the mechanics and how things work have given you a knowledge that you otherwise wouldn't have had in how to manage your own problem, right?
Right.
What do you think about all that?
I love it. I love it. I love not being in pain. I know that, I guess maybe once there is a neck problem, I'm always going to have to be careful with it. I have to. I can't go throw bales of hay anymore. I have to be careful with what I'm doing.
My recollection, without pulling your chart, was that you were scheduled for surgery, weren't you?
Yes.
Tell me about that. You were told basically that there was no other thing that can be done other than surgery.
Correct. Yeah, and
you were actually scheduled on the schedule, but for some reason something happened and you didn't get.
I didn't have the surgery. I was scheduled to go have C5-6 and C6-7 replaced, and I went to the hospital at 10 o'clock in the morning, and due to physician timing, I'll say. Without going into detail, I was released at 5:30 that evening without having any surgery done.
Now, but for that lucky consequence, you would have had the surgery and you'd be recovering from surgery right now.
Yes, I would.
And you didn't have to have the surgery.
No, I did not.
And are you convinced that with using my technique, over time, you'll remodel and be in even less and less pain
Yes.
and problem?
Yes.
Just by what you know of what has happened so
Right.
far?
And I may come back and have you help me with, another little, because we only did it the one time.
Right, it
and
only
I
took
am
a single episode.
to take me off of pain pills.
Right, right.
So.
And prevent your surgery. You were still scheduled to go back for surgery.
And I
Do
canceled it.
you feel now confident that you don't need surgery?
I'm not going to have surgery. No,
Right.
I am not. Not
But
at this point. I feel confident,
there was
yes.
an orthopedic surgeon or a neurosurgeon that was prepared to cut into your neck and fuse those bones together.
Yes.
And you'd really, it's not that it wasn't necessary. It's just that not many other people have the advantage of accessing me.
Correct.
Because there isn't an alternative therapy other than surgery, because they don't know about it. They don't know that I'm capable of doing that. And so it's a real kind of interesting phenomenon. That
Yeah.
you were right on the table, basically.
Yes.
You were under the lights and
I
were
was
saved.
there, ready to go, and my feeling is that
It's not like it's an opinion. But for some snafu, you would have been cut open
and had the surgery. Yeah, they would
had the
have
surgery in the neck and everything, right?
And it would have been
And you could fall and slip or something like that and push your disc out again and may come to surgery. I'm not saying that it won't in the future be required, but right now we have a lot of good clinical evidence to prove that you're no longer having those pieces of disc material pushing up against your spinal cord that makes surgery necessary.
Not at this point, not in my, I don't like surgery, and I did not want to go under the knife, but I was willing to.
Well, the reason I had my staff call was because I wanted to find out how you were doing, because I hadn't heard from you. I wanted to make sure you were better, and to give you those extra pointers on how to keep your neck in extension and the finer touches on the maneuver kind of information. Well, that sounds good to me. And you wouldn't mind if I put this on my website, would you?
No.